We tend to overlook the fact that outside the U.S. and Europe, work life often begins quite early. And in agriculture, it begins early everywhere, including the U.S. and Europe. And by early, I mean sometimes as young as 5 years old. In this presentation, I'm going to argue that young people's occupational health should be a top priority for us, and we have an important and very unique role in addressing it. First of all, why should we be concerned, we in the OSH community? You know, many feel that OSH risks and interventions are much the same for both young workers and adult workers, and therefore youth don't require any particular attention. Or others think that child labor is primarily a social problem requiring legal action, not an OSH problem that requires our interventions. The first reason I think we should be concerned is because simply there are so many child workers. 218 million are currently working. Only a part of these are doing age-inappropriate work, but all are potentially at risk because they're working. The ones of particular concern for me are the children aged 14 to 18. They're of legal age to work, but are considered child labor if the work or the working conditions they're in put them in danger. There's a growing population bulge in this age group in the lesser developed countries, creating a serious youth unemployment problem. Out of school, needing money, they're pressured to take whatever kinds of jobs they can get, even dangerous ones. In the EU, for example, the percentage of unemployed youth ranges between 4 and 25%. Now, this next graph gives you kind of an overview of the differences between countries in terms of the numbers involved in hazardous child labor. And you can see that all continents are concerned. The second reason why we need to be concerned is because young workers have high injury rates. ILO did a study using data from 21 countries, extrapolating them globally. And we found that in a one-year period, over 106 million children aged 5 to 17 experienced a work-related injury. That's over 100 million children. Of these, 15 million had a work-related injury sufficiently severe that they were caused to stop work. The third reason why we should be concerned is because childhood is when you prevent the conditions that we worry about in adults and older workers. We don't have global quantitative data on the percentage of children who are working due to incapacity of a parent, usually a father. But I would estimate it is extremely high based on our qualitative data. A graduated curriculum starting in primary school would help children to identify and avoid risks and would be especially appropriate in LDCs because many of those children drop out early to go to work. And you need to get the message to them early. What is the risk? How to prevent it? How to avoid it? Another reason, as if one is needed, is because we have to make up now for not paying attention to young workers in the past. This may be because it is assumed that kids are robust and resilient and are not doing particularly dangerous work. But we don't know because occupational health and safety assessment instruments, not to mention TLVs, are not geared to youth. So what is hazardous for youth? The ILO conventions and accompanying recommendations do a good job of showing that, and I will just flip through here to show some of the key points. Work that exposes to physical, psychological, sexual abuse, work underground, underwater, at heights, work with dangerous machinery, equipment, and tools, work with heavy loads, work for long hours, or confined to the premises of the employer. Work in an unhealthy environment where children are exposed to hazardous substances. I'd like to stop on this one because we note that agriculture is considered one of the most hazardous occupations for children. It's also one of the largest, probably the largest employer of children worldwide. It's hazardous because of the increasing and improper use of pesticides, which adversely affect the developing brain and nervous system, and because of the increasing and improper use of heavy machinery, tractors, saws, silos, manure pits. And as less developed countries adopt these practices, more children are exposed. To give you an example, Saida Wong in Pakistan had been doing studies on threshing machines. They used to be hand-driven. Now the blades are turned by an electrical motor. And as a result, the electrocutions and amputations are on the rise. Occupational safety and health is needed in order to clarify some of the ambiguities in that list that we just went through. How long are long hours? How heavy is a heavy load? What constitutes psychological abuse? The ILO child labor conventions have been ratified by over 160 countries. They're almost universal. And they require each country to make a list of hazardous work. And these countries are asking, on what basis do we decide? In other words, what is the evidence base for hazardous child labor? Most of the policy work, unfortunately, is being done on, shall I use a technical term, seat of the pants, you know it when you see it basis. Youth are at higher physical risk. You already know this, but it bears repeating. Children are at higher physical risk because they are still developing in their brains and bodies until their 20s. So this is not a full list of their vulnerabilities, but it serves to emphasize the wide range of potential threats. There are a couple of special cautions that tend to get overlooked. First, many people try to handle the dangers facing young workers by just having them use PPEs, protective equipment. We don't condone that for the above reasons, in addition to all the reasons for adults, because they're a means of last resort. But for children, they're too big, they give a false sense of security, and they're just not cool, so they're not used. Secondly, children need more sleep. Yes, many families rely on their children to put food on the table, but a child without education will be hampered for the rest of her life in a globalizing economy because they require new and different skills that can only be gained not in the mine, not doing housework or hauling garbage, but in school. The big important gap I want to raise with you today is that of psychosocial risks and impacts. Occupational risks or psychological risks are particularly, I would think, actually probably one of the greatest areas of risk for child workers and younger workers. Sometimes it's the only case, as in the case of child domestic workers. They have little job control. I don't know if you know that many of them are not able to join unions until they're 18 or 21 years old. They are often the target of jokes or intimidated, harassed, exposed to adult behaviors such as drugs. A lot of them have precarious contracts leading to a sense of extreme anxiety, which is particularly accentuated when they're carrying responsibility for younger children, younger siblings. So many young workers have told me, I'm working so that my younger sister or brother can go to school. The reason that we did the brick kiln studies in the ILO was to get an evidence base under the psychological issues. The brick kiln studies looked at 4 countries in Asia, and it was a comparative study comparing children who were working in the kilns and those who were not, who lived nearby. We studied physical health, psychological health, environmental health, working conditions, and work activities. Here are some pictures of the children. The findings from the psychosocial component were that there were massive and unequivocal differences between the working children and the control group in several psychological domains: social support, depression, anxiety, and so on. Secondly, each year of work was associated with an increase in emotional problems. Third, of the working children, all countries, girls were at demonstrably greater risk. The fourth was a startling one. We found that schooling had an important protective effect, regardless of the quality of the local schools. In fact, those children who were both working and going to school had a profile very, very similar to the children who were not working. So I would draw these final conclusions then and recommendations. We as health professionals have a lot of credibility with policymakers and parents, and OSH research is a powerful way to convince them why young workers are at risk and what actions they should be taking. For 14 to 18-year-olds, the action is clear: reduce risk exposure. Our aim is to keep them in work and to reach all of those at risk. For the younger ones, we need to do everything we can, working with other parties, to get them into school. Secondly, we need youth-relevant tools and assessments. We need to include all workers in our studies, the young ones, the part-time ones, the seasonal ones, in all of our assessments and baselines. We also need to not go on fishing expeditions. They waste time and money doing general health exams. We need to zero in on those which are the health risks most likely in a particular economic sector. In mining, for example, it's mercury. That's one of them. Then we also should not assume the children have just one job. We need to compute the total number of hours of work, especially for girls. It includes chores and home-based enterprises. Finally, what I call YOSH, Youth Occupational Safety and Health, is an ideal field for work for young OSH grads and new projects, and we hope that people will take that into consideration in the future. We welcome their involvement. Thank you very much.